Today, we are very excited to be releasing our oral health brief titled Sonrisas Saludables, the 2024 State of Latine and Indigenous Oral Health in California. Next slide, please. So we are releasing this brief. It analyzes publicly available data to highlight the current oral health outcomes for Latines and Indigenous in California. The brief also provides an analysis on systemic barriers for these populations to equitably access oral health coverage and services. And lastly, it provides policy recommendations to improve oral health outcomes among Latinas and Indigenous Mesoamericans in our state. And we will hear more about these recommendations during the presentation. But for now, I do want to encourage folks to download our brief. It is available on our website, and we will drop a bit.ly link for you all to download the brief. So hopefully we can get that into the chat, and if not, we will follow up. We will be following up with an email if you registered for this webinar. So very excited to be releasing this brief today, and thank you to everyone for all of the support to get this brief done. So really excited. And so we are really excited to also be in conversation today to discuss key takeaways from the brief with experts and oral health equity leaders in the field. Today with us, we have Jessica Moran, legislative advocate with the California Dental Association. We also have Eileen Espejo, health senior managing director at Children Now. And of course, Dr. Ceci Aquino, executive director with the Latino Coalition for a Healthy California. And so we will hear from our panelists after the presentation. And now I would like to turn it over to Dr. Ceci Aquino, executive director at the Latino Coalition for a Healthy California, who will present key highlights and takeaways from our brief, Sonrisas Saludables. Dr. Aquino.
Muy buenos días. Thank you so much, Mar. Thank you, everyone, for joining us this morning. We know it's a busy morning, but we're so excited to talk about oral health. As you know, oral health is critical to our overall health and well-being. If you think about it, anytime you enter a room, right, a smile is what helps you feel connected. A smile is what helps you feel welcome. It makes you feel comfortable. And to think about the impact, both physically, emotionally, and spiritually, that a smile can have on your day-to-day and your long-term life is greatly impactful. For me, this is a little bit of a full circle moment. I actually started my career in public health in dentistry. I started volunteering at the USC Dental School back in the day when I was still in middle school. And I fell in love with the profession because my mother, who is a dentist in Guatemala, decided to leave everything behind, her love for the career and her job, to protect her family. And so we immigrated to the US. She was no longer able to participate as a dentist in society, but her sacrifice led and fueled my passion for public health, but it did start from the sweet place of really appreciating and loving oral health. So while I didn't grow up eating too many candies, I did grow up for a love of brushing my teeth and flossing, and going to the dentist was one of my favorite activities as a kid. Give me a treasure box, a toothbrush, and it's my jam. So today we're so proud to be talking about the importance of oral health. Oral health is one of those fields that can many times be put on the side, right? We don't necessarily think about oral health until we have an acute pain, right? Think about when you had a dolor de muelas and it was really hurting you, and then you knew you had to go to the dentist, right? But how many of us are actively making those appointments to get our teeth cleaned and to make sure that we're using preventive methods to take care of our oral health? Now, that's just the acute individual impact. But when we think about the critical role of oral health on our physical, mental, social health, and the way that it's influenced by social determinants of health, where we at, what access we have to be at a dental clinic or to resources to pay for preventive care or other services. It can have a huge impact on the way that we show up on a day-to-day life. For many children experiencing dental caries, they experience a higher rate of not showing up to school, which impacts their education. So just thinking about that large of an impact, oral health is critically necessarily to be addressed in order to advance health justice for Latine and Indigenous communities. So our report today, Sonrisas Saludables, 2024 State of Latine and Indigenous Oral Health in California, really focuses on talking through these disparities for our Latine and Indigenous communities. We know that as Latinos, we're not a monolith, right? So we try to be very intentional to talk about our Latine and Indigenous communities as a whole. And in order to address equity for oral health in our communities, we must advance both acute and long-term solutions. And you'll see that reflected in our policy recommendations. So if we can advance to the first slide, the next slide, our first takeaway here. So let's talk about disparities. So Latine and Indigenous Californians experience disproportionately higher negative oral health outcomes driven by systemic barriers to access and exacerbated by social determinants like poverty. In California, 72% of Latine and Indigenous elementary school children experience higher rates of tooth decay compared to 40% of white children. 57% of Latine and Indigenous adults are likely to have an annual dentist visit compared to 73% of white adults. And 38% of low-income older Latine and Indigenous adults ages 65 and over are less likely to access oral health services. So as a whole, access is increasingly difficult for Latine and Indigenous communities. So we really need to think about how do we make it more accessible? How do we lower those barriers to make sure that oral health is included as part of our culture, a culture of care? If we can click to the next slide. For our undocumented community members, it's extremely difficult to access. And when we think about the greater narrative across the nation and anti-immigrant sentiments, issues like public charge come up. And unfortunately, as we know and we saw in the last Trump presidency, it can have a huge fear-mongering effect amongst immigrants who then decide to take a step back and not access life-saving care. And this can have an effect on our oral health. For our Indigenous Californians, there are a lot of language barriers that come up. Not everyone speaks Spanish or English. And so making access to dental health services in Indigenous languages is extremely important so that our communities can be served well. Next. Our takeaway number 2, access to dental insurance for Latine and Indigenous Californians is limited. And when accessed, coverage can be difficult to navigate. As we know, in the system that we exist in, dental insurance makes a huge difference. Dental care can be highly expensive. I don't know if any of you have tried to pay out of pocket for a cleaning or for any kind of care or service, but it's extremely important and expensive. And so in California, only 32% of low-income Latine and non-citizen immigrant workers have job-based health insurance. Think about that, only 32%. So if folks don't have access to dental care insurance, where and how are they coming across access to dental care? State-sponsored health insurance. Over half of Medi-Cal eligibles are Latine, with roughly a third speaking primarily Spanish. So we know that our community is utilizing oral health services under Medi-Cal to be able to get at least some sort of care for their oral health. And during the pandemic, we saw that systemic changes actually helped tremendously. So Latina healthcare uninsurance rates fell from 11% to 9% due to the pandemic era protections that maintain Medi-Cal coverage without renewal. So we really have to think about what systemic changes will ensure that we improve healthcare outcomes, in this case, oral health. Next. Latine and Indigenous communities experience a lack of dental care services that are culturally and linguistically appropriate. So Latinos, Latine and Indigenous communities, we make up 40% of the population. That's a huge number. And Latina dentists make up 8% of overall dentists. So just think about that huge disparity. That means that there are not enough Latinos and Indigenous community dentists serving the Latina and Indigenous community. What does that mean? That there's a lack of understanding in terms of the provider and the patient. There's perhaps even more fear. A lot of people are fearful to go to the dentist. It can be nerve-wracking, all the noises, even the smell of walking into a clinic, right, can be a little bit intimidating. So just having someone in the room that looks like you, that can speak your language, that can understand you, that can understand certain practices, cultural practices that impacts oral health, and have an honest conversation about perhaps making some changes, can have a huge effect in our oral health. When I served as a promotora for the USC CHAMP program, we used to go across the community to serve and to educate on oral health. And one thing that we found was that in Black and Brown communities, we were seeing a lot of children drink juice from a bottle. And we knew, right, that was perhaps a cultural practice that was common and accepted, but it was very dangerous for oral health. So, you know, speaking in Spanish was hugely helpful in having some of those perhaps tough conversations and sharing, hey, this might not be great for your baby, and you might want to replace this with water and give juice in a cup. So it's really, you know, sometimes it's the most innocent of conversations can have a huge effect, both acutely and in the long term. So we must increase that diversity. Next. Our Indigenous communities often lack access to dental care in their preferred language. This is an amazing quote that we received in our 2023 listening tour across the state. This is from a participant in Oakland. I can't speak Spanish well, and that's why there's an interpreter in the mom language. The interpreter, who is our people, can help by telling me the words in mom. And we know that's huge, right? We need to understand what the dentist is saying, and we need to communicate what is going on. If we cannot communicate in our language and in a way that we feel comfortable, how are we getting quality service, right? So it starts there. Next. Other factors that impact oral health include socioeconomic conditions where people live, work, and play. Barriers to affordable and quality dental care can exacerbate other chronic disease that Latina and Indigenous communities face. So when we think about poverty, just the cost of living in California is so high that with 2 working adults and 2 children, we would need about $129,000 on average to afford basic living necessities. And yet 68% of Latina and Indigenous Californian households make less than $100K a year. So really, for many of our communities, it's not even a possibility, right, to think about paying out of pocket or to think about oral health services that are not covered by insurance. So we really need to protect our communities and improve our well-being so that we can have greater access to care, coverage, and access. And then as a whole, like we talked about at the beginning, oral health can sometimes feel like it's disconnected from the rest of the body, because going to the dentist is a whole other process than just going to your physical doctor. But oral health disease can actually have a huge impact on the rest of the body. If you have a caries that turns into an infection, that infection can easily travel to your brain or somewhere else in your body. So really thinking about the potential issues that something as simple as dental disease can cause. Gum disease can impact greatly just everything from putting you at a higher risk for developing, if you have diabetes, it raises the risk of developing gum disease by 86%. So just thinking about the way that other disease can exacerbate or be exacerbated by oral health disease. So we have to think about the whole body when we think about oral health and its impacts. So where does that lead us? There are these 4 key takeaways on why is it needed. And now we start thinking, right? Okay, so here's the issue. How do we address these issues acutely and in the long term? So next, here are our 4 policy focus area recommendations: quality and access, workforce and culturally competent care, system integration, and leveraging community partnerships to promote dental care. Next. So under our quality and access to state and federally funded dental care, we really are thinking about Denti-Cal, right? Increasing Denti-Cal reimbursement rates for Medi-Cal providers with additional incentives to dental providers offering services in low-income and rural communities. Many times what we hear from community members is that there's no provider in their area that accepts Denti-Cal. And many times what we hear from the providers is that the Denti-Cal reimbursement rates are so low that they're not incentivized to take Medi-Cal patients. And so there's this disconnect. And in order to close that gap, we need to improve both systems. Improving quality of care in Denti-Cal clinics. So if you have ever had the chance to go into a Denti-Cal clinic, unfortunately, the care can look greatly different than a private office. And unfortunately, the lack of quality can have a huge effect on a family coming back into the dentist for preventive care. If you're not receiving care or support in an environment where you can feel comfortable, it's less likely that you will show up again for preventive care or even acute care. So it's really important that the moment that someone walks into a clinic that they feel comfortable and they're getting the best quality available, regardless of how they're paying for it. And then making permanent pandemic era rules to increase and maintain that Medi-Cal coverage and ensuring that people have access throughout the year. Next. Our workforce and culturally competent care. So again, we talked about the workforce, right? So making sure that we're increasing a workforce that actually represents our Latine and Indigenous communities. So let's raise that number. How? Let's create stronger pipelines. Make sure that our students of color, Latine and Indigenous students are able to A, apply to dental school, and 2, graduate from dental school so we can have more dentists. Many times it's an issue of funding. So how are we improving scholarships to make sure that our students make it through? And then more acutely, implementing a program to license international and or undocumented dentists. So if you think about the potential workforce that exists but is not able to practice, there are many folks from across Latin America that immigrate and are unable to practice in the United States. And so let's think about a way to actually utilize this great skill set that they have. And in other states, there are opportunities for international and undocumented dentists to practice dentistry, but not here in California yet. So let's think through that. Let's partner on that and move forward some policy solutions to address those disparities. Next. System integration. So establishing adult dental care as a permanent benefit under Medicaid, as recently introduced through federal legislation. We know that oral health diminishes, especially as you age, right? So we need to take care of our teeth and our oral health as much as possible. For our elders, is especially important that we make sure that they have access to that care. So establishing that permanent benefit can have a huge effect on their well-being. Integrating oral health programs and services into primary health, making sure that integration is clear from a systems perspective, right? And folks don't feel like it's two separate systems that they're undergoing when they think about oral and physical health. And facilitating interagency coordination. How are we making sure that our agencies are speaking to each other and supporting one another, especially as we know that oral health impacts our overall health? And finally, leveraging community partnerships to promote dental care. So if we move to the next slide, partnering with community health workers and community-based partners to develop effective program outreach and development. We know that CBOs have that trust from community members, right? We've built it over years and years, and so it's necessary that we tap into that trust and communication networks to make sure that our folks are receiving the right information and can have support in navigating the system to ensure access. And finally, implementing innovative models such as school-based oral health programs and services. We know that a huge public health strategy is meeting people where they're at, and especially for children, showing up and setting up either a mobile clinic or a smaller section, partitioning the school and having oral health services available for a school health fair or some sort of mobile care makes a huge difference in addressing oral health needs. So I will pause there, and I am excited for a very rich conversation with our guests today.
Awesome. Well, thank you so much, Dr. Aquino. We are so excited to dig in more with our panelists. So I do want to bring up our panelists now. We have, again, Jessica Moran with the California Dental Association and Eileen Espejo with Children Now. And so would love to start with you, Jessica. As you heard, in terms of diversity, we really need to improve those numbers to have more Latine and Indigenous oral care providers, specifically dentists. So would love to hear from you. What is the California Dental Association doing to increase the diversity of dentists, specifically Latine and Indigenous dentists in California?
Sorry, I had to make sure I was unmuting myself. Hi, everyone. Jessica Moran with the California Dental Association. Appreciate the opportunity to be here and speak to you all today. So just a little bit of background on CDA and what we do. So we are a membership association for dentists. We represent 27,000 dentists throughout the state from a variety of different ethnic backgrounds who practice in a variety of different settings across the state. So yes, definitely, we understand the need for a culturally competent workforce, a workforce that is reflective of California's population. As Dr. Aquino mentioned, about 8% of dentists in California identify as Hispanic or Latino, and that is only about a third of the actual population of the state. So while California does actually have the most diverse dental workforce in the country, there is still some progress that that can be made. So some things that we do, CDA, we host workshops with all 7 of California's dental schools to monitor their recruitment and pathway programming prior to a student entering college. So really making sure that they understand the path that it takes to be a dentist, even knowing that dentistry is a possibility for them. I know a lot of college students enter college thinking, they want to be physicians. And no, I feel like not a lot of people really pursue dentistry unless you are aware about it or it runs in your family. So that is one way just to get the word out. Another thing that we supported last year was the creation of a DDS Aspire program at UC San Francisco. So that, again, is going to allow UCSF to create resources to increase recruitment and coursework focused on bringing in diverse communities into the dental profession. And of course, like I mentioned, introducing dentistry to folks is only the first step. Dental school can be very expensive. College is expensive in general. A lot of dentists, unfortunately, are graduating undergrad and dental school with nearly $500,000 in debt, which can be a deterrent to a lot of, people from underrepresented backgrounds who may not have the financial means. So some things that we have done in that area: in 2016, we advocated for the Prop 56 tobacco tax, which passed on the November ballot. And that money was reallocated to fund a lot of different healthcare and public health spendings. But one of the unique opportunities we created through that was the Prop 56 loan repayment program. So if you are a provider and you commit to serving Medi-Cal patients for at least 5 years in an underserved area, you are eligible to have up to $300,000 of your loans repaid by the state as long as you make that commitment. Some other things that we have advocated for in 2022, we advocated for $10 million to create community-based clinical education rotations for dental students who are in their 3rd and 4th years and are starting to get their dental hours, instead of having their only exposure being the school clinic. This program allows the schools to partner with FQHCs in some of the more rural areas. And when I say rural, I don't only necessarily mean like Central Valley and like farm worker communities. I really mean, Inland Empire and the North Coast and down in the Imperial Valley. There are lots of places in the state where we acknowledge there is not enough providers in general, and definitely not enough culturally competent providers. The last thing I want to mention that we advocated for was $50 million in 2022 to create a grant program to build actual infrastructure of dental clinics for patients who have special needs and disabilities. And part of that grant program would be the provider would have to be enrolled as a Medi-Cal provider. And this does not directly impact the Latino and Indigenous population, but of course, some of those folks are going to be captured in the definition of special needs and complicated healthcare needs. So allowing them to receive the care that they need. Right now, if you are a patient who has, for example, autism or has a cognitive disability as Alzheimer's, it's really difficult for them to receive dental care in traditional dental office. So this is going to allow to increase capacity throughout the state. That way there is somewhere in their neighborhood they can go to where they know they accept Medi-Cal, where they know they can treat these patients who have these medical needs. So those are just some of the things that we have invested in. I think a lot of these programs, of course, require a state budgetary investment. And given the state's current financial situation, I think it has us on a little bit of, we've been playing defense for a lot of the year. So hopefully when, the budget is improved, we're able to continue to advocate for some of these programs and really extend that pipeline down. And of course, we at CDA represent dentists, but it's the entire dental workforce. It's the dental assistants, the hygienist, the front office manager. Everyone involved needs to be culturally competent in order to serve the patients that they serve, and also just to build that relationship and that trust and that dynamic. Understand that going to the dentist can be really scary for a lot of people who either have never had dental care or haven't gone in a long time because of lack of insurance. So all of these barriers are not so much barriers. All of these things are things that we can improve to make the dental experience better for these populations.
Yeah, thank you so much, Jessica. I really appreciate everything that you've highlighted. I really, appreciate the piece around making dental school affordable, especially for, Latines, Indigenous population students that might be interested, but they hear about that price tag, and it might just not be something that they want to pursue because of that, right? We know that student loans are a huge burden for Latines, and so appreciate everything that CDA is doing to make sure that we do increase those dentists of color, Latina dentists, and everything that you're doing around the state budget to make sure that there's scholarships, to make sure that there's support. We just sort of heard about the final deal, and so seeing that many of those really important services for our communities were on the line, right, to be cut. And so continuing to be those advocates, right, so that we continue to have those services available for our community. So thank you so much. All right, I want to now turn it over to Eileen. And Eileen, you know, we did discuss a little bit of the oral health outcomes for children. And just in terms of your work, you know, what are some of the oral health disparities for children that that you're seeing, that you would like to highlight, and also barriers that you're seeing in terms of access to dental care for children in California?
Yeah, thank you, Mar, and thank you for having me today, and congratulations on the release of Sonrisas Saludables. That's very exciting. So good morning, everyone. My name is Eileen Espejo from Children Now. In answer to your question, you know, what we're finding is that a recent study that we did actually saw that children who are Latino and Asian were using Medi-Cal dental services at a higher utilization than their peers. However, as we know, that doesn't necessarily mean that just because you're getting to a provider that you're not still having cavities or you're getting cavities again. So to me, while it's about utilization for sure, like, are you going to a dental provider? Are you accessing services? How do you stay in good oral health? So how are you maintaining, making sure that your child isn't having cavities or that your child isn't experiencing something else that's going on that might not have been treated? What we are finding, as you've found in your brief, there is a lack of Medi-Cal dental providers, unfortunately. There are a lot of dental deserts in the state of California. We have an aging dentist population in and of itself. They're getting ready to retire. And as you just pointed out, Jessica, you know, we got to make the dental workforce appealable and, you know, of appeal to these young graduates. And not only that, but to also encourage them to embrace a public health dentistry career. Because it really is about the children and families that are experiencing poverty that are likely accessing dental services less, even though Medi-Cal does provide for dental benefits. If you are a family that is lucky enough to find a Medi-Cal dental provider, the next hoop you have to jump through is this a provider who's going to, who I can trust? Is this a provider who speaks my language? Is this a provider who, for working parents especially, is this a provider who's open on the evenings or the weekends? And then after you get to that, is this a provider who will see kids? Because it's one thing to find a Medi-Cal dental provider, then it's a whole other thing to find out whether or not that Medi-Cal dental provider and their office, you know, we're talking about how do you make sure it's a welcoming experience, not just for the parent, but really for the child. Because if you really want to invest in creating a dental home and making sure that that child keeps showing up, or that parent keeps bringing their child to the dentist, then you really need to make sure that it's a welcoming environment. And, you know, I don't know what it is like in the private dental world, but just making sure that the workforce is welcoming to kids, I think is really key. The other thing I'll say in terms of disparities is that it's not just a lack of disparities in terms of education to parents and families about when they should be bringing their child to a dentist, like first tooth, first birthday. I'd also offer that it's sometimes the dental providers and medical providers themselves. So really taking advantage of making sure that the medical and dental communities are also reinforcing that message of first tooth, first birthday, of making sure, because we know that most times children are seeing their pediatricians more often than they're seeing a dentist. So it's also about educating pediatricians, like, can you help reinforce these messages that it's not just about the medical care that medical office might be providing, but it also is about oral health care. So are we using all the people that are part of making sure that children are healthy? Are we activating all of them and educating all of them? I would go so far as to making sure that OBGYNs are educating pregnant individuals, you know, when you're going to have a baby, and also making sure that that pregnant individual is maintaining their good oral health and also seeing a dentist. Like it can go, as we can try to go as far upstream as we possibly can, just to make sure that it's a normal message, right? So that everybody is just receiving the same thing, from parents to providers to community-based organizations, that we're all saying the same thing. And the last thing I will say is that when we talk about access to dental care, there are things such as community water fluoridation that has been proven and that the Centers for Disease Control say is something that there are safe levels of fluoride in tap water. And I know it's a huge, huge thing for people to say, but my tap water is not clean. If your tap water is clean, there are safe levels of fluoride that can help prevent and provide your teeth with that healthy nutrient to keep cavities at bay. So there are things even in our community, and some communities do not have access to community water fluoridation. So when you talk about disparities and looking at the environment in which some of these children and families are growing up in, it's really making sure that they have access to all the things, from water, of course, to providers, of course, to bringing care to where they are, but really looking at anything and everything that could possibly impact a child's ability to thrive and be healthy.
Thank you so much, Eileen. Yeah, definitely it takes more than just the dentist, right? To make sure that our oral health is in good standing, that we're really being proactive. You know, in terms of the water and the fluoride levels, and you know, that comes down to those social determinants, right? All of those things are impacting oral health. And so I really appreciate you elevating those pieces for us. I want to now turn it over back to Dr. Aquino. Dr. Aquino, you did share a little bit about what we heard during the 2023 listening tour that LCHC conducts every year. We heard a little bit about the experience for Mom Indigenous speakers, language speakers, but are there any other highlights that you'd like to share with us regarding oral health and what we heard from the community in terms of oral health?
Yeah, definitely. And I'll just share, it's extremely important for us to listen to community members, right? It's really easy to approach this work from an academic lens, but if we just pause to listen to community members, both Latine and Indigenous, around their experiences, we can learn so much and actually drive sustainable changes within policy and system transformation that can actually be sustained across time. And for community members, what we continued to hear again and again was access and quality. So it was either there's no one that I can go to in my area, or there's one dentist, but I know that they don't provide good care, or I feel like there's predatory behavior around just checking everything off in terms of the DentaCal benefits and what my child needs, versus my child actually just needs a cleaning and there's no need to do XYZ. So there are practices that actually create fear, unfortunately, in our communities, and it impacts the way that that provider as a whole can be trusted. And so we need to again and again be able to listen to those experiences and use that as wisdom to make changes to the system. So again, centering the fact that communities need access in language, not just Spanish, but Indigenous languages, and they need the utmost quality of care and trust in their dental providers.
Absolutely. And I do want to just quickly follow up and see, there was also a piece around Latinas actually having to cross the border, going to places like Tijuana to access dental care services because of the high costs in the US and specifically California, right? We had our listening tour all across our state. And so I'm wondering if you can illuminate some of what we heard there.
Yeah, of course. So for many community members, because of that high cost and lack of dental insurance through their employer, they found that it was easier to go back to their either countries of origin or to cross the border and get care. And we know that it's, in terms of cost, it's a lot more affordable, right? That's what community members told us. When I'm able to cross the border, yes, it's a more intense process to go and come back, but I know I can afford it. I know that I can communicate with my provider in language. They'll listen to what I have to say, and be more responsive to my needs. I spend a whole day there, come back and have everything done. And so it's important for us to understand that people are going through extremes to get access to something that they should have down the street. And so if we're not being responsive and making sure that we're opening up clinics that can actually see our community members in language and in a safe manner, that we're actually increasing barriers and putting folks at risk for something that they deserve, like oral health services.
Thank you. And so I think we have a time for a few more questions before we get into audience Q&A. And I do want to just bring Jessica back. We did hear a little bit about Medi-Cal and Denti-Cal, and just seeing that, for us as Latinos, many of us are receiving, dental care coverage through Medi-Cal. I'm wondering if you can, if you have anything to add around our utilization in Denti-Cal, and then also, we've been hearing about it being very challenging to find dentists that do accept Denti-Cal. So anything that you can share with us about that piece there.
Yeah, thank you. So, with the Great Recession that happened 2008, 2009, adult dental was actually cut from Medi-Cal benefits. So a lot of adults were unfortunately, unenrolled from coverage, and it took 5+ years to restore those benefits. So I think that, unfortunately caused a big rift in the utilization amongst adults. Especially, I remember before I worked at CDA, I used to work at an FQHC doing outreach and enrollment, and that was right when they restored benefits. So it was right around 2015, and that was the big sell to get people to enroll at an FQ. Like, we offer dental now. It's that big of a selling point for people who, understanding your teeth are so important to your overall health. And, of course, your smile is so important. So I think we're still kind of recovering from that Great Recession cut, and just utilization rates, have gone up, but they are still relatively low. Want to acknowledge that. And, finding a provider is difficult, especially a specialist. If you need, a root canal or an implant or anything more than just a routine dental visit, it is difficult to find a Medi-Cal provider in your area. And, there has been a lot of good work in the Medi-Cal program to improve administrative barriers, as well as some of the Prop 56 tobacco tax money went into reimbursement rates. So some standard rates saw a 40% increase, which has really made the program more sustainable for providers to be. And their, Medi-Cal rates are low, of course, as we know. California has so we're hanging out in the middle of where rates are compared to other states, depending on who you ask. So there are some improvements that can be made there, again, especially when it comes to specialists. A crown or an implant, for example, can cost $1,200 market rate, and the Medi-Cal program reimburses about half of that. So it needs to be sustainable for providers to take these patients. And we have seen, again, significant improvements in the last 7 years. We've seen a 20% increase of providers who are accepting Medi-Cal dental patients. About a third of CDA's membership are Medi-Cal providers. So while we have made gains, there are still things that we can improve. And a lot of them do come down to budgetary investments, expanding benefits, increasing reimbursement rates, things like that. But we do meet regularly with the Department of Healthcare Services, who administer the Medi-Cal program. And, of course, we advocate within the legislature to get these things done, and really just trying to make sure the program is functioning in a way that, of course, like I mentioned earlier, it benefits patients, it benefits providers. If we can kind of triage some of those administrative burdens before they get to the point where the provider is fed up, we can kind of maybe save a relationship and a provider being enrolled in Medi-Cal. So those are some of the, things to be aware of when it comes to Medi-Cal provider rates being low. A lot of it are just systemic changes that needs to be addressed.
Got it. Thank you so much. And Eileen, speaking of the state, as I understand, you know, you do convene the California Partnership on Oral Health, are an active member of that group. And so I'm wondering, can you tell us about that partnership? What are you all working on to improve oral health outcomes among Latina and people of color in California?
Sure. Thanks for the question. So yes, through the California Partnership for Oral Health, which I co-chair with Dr. Paul Glassman, he serves as chair. We are a diverse group of over 50 agencies and individuals. I see many on the call today. CDA and Latino Coalition for Healthy California are also part of the Partnership for Oral Health. And we're really, we come together to talk about and support and implement the California 2018 to 2028 State Oral Health Plan. So there is a state oral health plan at that the partnership comes to make sure we're implementing it and to also discuss challenges or opportunities to just make sure that we're advancing its implementation. There are a lot of goals in this plan. The one that I would elevate here in terms of how it relates to the brief that you all are releasing today is there isn't a goal within the state oral health plan that looks about leveraging partnerships, working with, you know, payers and providers, et cetera. And there is an objective within that goal that looks at how do you leverage the community health worker benefit. And I think that's super key. It's super timely, just given everything that has or hasn't happened with the community health worker benefit, I'll say. And the partnership has organized itself into work groups. So there is, for example, a community health worker work group. And I do see Dr. Francisco Ramos Gomez is on the call, and he actually chairs that work group. There are several other work groups as well. So there's there's a policy work group, which I happen to be chairing as well, that's looking at what are the policies that we need to help advance implementation of the state oral health plan. And there's also a school dental work group, which is trying to reach all populations of children who are at schools. And so how do we really improve the establishment or the expansion of school dental programs? All related to this, I really want to make sure I get this in, is that every local health jurisdiction in the state of California received funding that was, that's through the Prop 56 funding that Jessica has been mentioning, that the State Office of Oral Health did give to every single local health jurisdiction. So every local health jurisdiction in California has a community oral health improvement plan that was informed by community partners. So community-based organizations, individuals, agencies. So think about like, community-based organizations, but also like, hopefully there's schools at the table. Hopefully there's the Medi-Cal managed care plans at the table because they also have a role to play. So each county has a plan to help decrease oral health disparities and to think about things of like, how are we educating our community about the services that exist, or what are the programs we need to start really making sure are established? What's the infrastructure that we need so that we are reaching those who haven't yet been able to access services before? And really thinking about it from a holistic way. And I think the partnership is, we're comprised of these groups and individuals, but this work can definitely happen without the work that the counties and the community-based partners are also doing. So we try through the partnership to understand what those challenges are and then think about ways that we can, through the partnership, address them, including through advocating for, things that affect the state budget, for example, as Jessica's been talking about, or also state legislation, or maybe it's as simple as figuring out how do we advance things, not simple, I should say, but how do we just educate all the groups that we are in partnership with to also activate their networks, to collaborate and advocate and coalesce around the shared goals and policies that we're trying to advance to close those oral health disparities. I'd be happy to also send a link, maybe as part of follow-up to that state oral health plan.
Yes, that would be great. And I'm used to having my reaction button, and I just wanted to do all these hearts, everything that you were saying, because I think you're absolutely right. It takes all of us who maybe we're advocating specifically on Medi-Cal, right? But we're not so much talking about the Denti-Cal piece, or we're talking about access, right? And so we need to also think about, you know, how do we also advocate for the dental benefits, dental services, making sure that those are available. So loving all of those potential collaborations that we have, and to just educate ourselves more on what we can support. And so I'm seeing that we're close to time. I do want to get to at least 1 or 2 questions from the audience. And maybe we can start off with this first question, which I think is a good follow-up to what Eileen was just talking about. So what type of programs and policies can we support to ensure dental clinicians from Latin America, and other parts of the world who immigrate to California can practice here? Yeah, that's a great question. Maybe perhaps I can direct that question to you, Dr. Aquino.
Of course. Well, I think it's a really good question. I think there's a reason why it's not currently in place. I think there's a lot of research that needs to be done to assess the different pathways in which we can accomplish that. I think there's a lot of different policies in place now around the type of training that a dentist receives, the type of practice that they're able to have. And a lot of the questions that come up with undocumented or folks that are trained outside the country are around quality of training and how it compares to US standards. And so what we see across other states is that there's opportunities for dentists to become dental assistants or dental hygienists, or just have greater access to education, or perhaps putting in sealants in children's teeth, but not necessarily practice in their full scope as dentists. So I think there's various paths within that opportunity to increase access. But what we find is that even with limited scope support for those dentists, you're able to increase access to education. Sometimes those preventive measures like sealants or teaching and educating how to brush your teeth makes a huge difference for both children and their families. And so, you know, we need to start exploring what is possible. We have been able to accomplish it with other groups like physicians. And so there's an IMG program in California where internationally trained doctors are able to get support and training to then practice as a dentist. So we can look at these other examples, take what we can, and create something that works for California.
Great, thank you so much. And we know that, you know, outside of the dental field, we have a program that, you know, supports physicians who were, you know, physicians in their native country in Latin America, and have a pathway opportunity to become a physician in the US. And so we can hopefully maybe do that one day for dentists. Okay, and I am seeing that we are at time. I'm wondering if folks have any last words before we break. Unfortunately, we weren't able to get to all of the Q&A, but just want to provide our panelists just an opportunity to close.
Thank you so much for having us. Super exciting.
Thank you. This is great. Really, really appreciate being asked to, you know, talk about these issues. There were a few questions that I answered in the chat, and happy to connect with anybody afterwards if there are any further questions on any of these issues.
Awesome. Well, we want to thank everyone for attending our webinar today, and we will be following up with that link to download our oral health brief, Sonrisas Saludables. So again, thank you all so much. Thank you so much to our panelists for being with us today. Bye-bye.
Bye, thank you.
Thank you.